Hello and welcome to this special show on Rajya Sabha Television. I am Vishal Dahiya and here we take a stock of India's fight against COVID-19. Now today we're going to talk about the second Sero-survey conducted by ICMR. There are some very significant findings as far as this Sero-survey is concerned. Generally, a Sero-survey gives us the insights into how the virus has behaved and how various steps taken by us in terms of intervention or in this battle against COVID-19 are faring in terms of what effect does it have on the spread of this particular virus and the disease. And to understand these results and analyze them further, we're joined by a distinguished panel of guests. Let me first introduce them to you, beginning with Dr. Manoj Murhekar. He is the director of the National Institute of Epidemiology, the ICMR Institute, which conducted this survey. We also have with us Dr. Rajib Dasgupta, Chairperson, Center of Social Medicine and Community Health at Jawaharlal Nehru University, and Dr. Anil Gurtoo, Director, Professor and Head of the Department of Medicine, Lady Hardinge Medical College in New Delhi. Welcome all of you gentlemen to Rajya Sabha TV. Let me begin with you, Dr. Manoj, since you've been at the forefront of this particular Sero-survey exercise. If you could take us through the main highlights as far as results of the second Sero-survey are concerned. What does it say about our battle against COVID-19 so far and the way this virus is now behaving?
Yeah, thank you very much for this invitation. This second National Sero-survey was conducted by ICMR in collaboration with the State Health Department between 17th August and 22nd of September. And the methodology for this Sero-survey was very much similar to the first Sero-survey. The survey was conducted in the same 700 villages or wards from 70 districts in 21 Indian states. Unlike the first Sero-survey, the target population for survey this time was individuals who are aged 10 years and above. And we collected samples from about 29,000, more than 29,000 individuals, which were tested for IgG antibodies against COVID. And overall prevalence of infection was about 6.6%, indicating that 1 in 15 individuals were previously exposed to SARS-CoV-2 infection. We also estimated the prevalence in adults because the first Sero-survey where we estimated the prevalence only in adults. So in the second Sero-survey, the prevalence was 7%, indicating that compared to the first Sero-survey, the infection has increased about 10 times. We also found that the Sero prevalence was not different in different age groups as well as in different gender, in gender.
Okay.
But the significant finding what we observed was in compared to rural area, the Sero prevalence was higher in urban slums as well as urban non-slum areas. We also found that for every RT-PCR or RAT confirmed COVID case, there were about 26 to 32 infections in the country. And compared to first Sero-survey, this number was about, for every COVID confirmed case, there were about 80 to 130 infections. And this time it was about 26 to 32. And the lower infection to case ratio this time indicates that the number of tests have gone up significantly this time in the last 3 months. So these are, in short, brief findings of this second Sero-survey.
Okay, so it looks like, Dr. Manoj, it's a mixed bag out there. While it shows that our testing strategy seems to have been going in the right direction, the number of infections per confirmed test also has come down. But the presence of antibodies, as you're saying, just 6%, 15 per 1 in 15 individuals. That seemingly might be a cause of concern. Shows that quite a considerable number of population is still susceptible to COVID-19.
Yes, certainly. It indicates that still a large proportion of population is susceptible. It also means that our containment strategies are working. We are able to contain the disease. It has not spread to a large population till now.
Okay. Dr. Rajib, your views on these, results of this particular Sero-survey, looking at it from both angles in terms of our interventions as well as, what we have learned now based on these results as to where are we headed?
Well, Dr. Murhekar has summarized the essential findings of this survey. And as he also underscored, it's really the urban areas where, as we know, the epidemic started with, and not just our urban areas, but the more congested parts of the older cities. This is what we have been seeing in, say, Agra, Bhopal, Indore, and so on, as well as the slum areas. We also do not classify peri-urban areas, or peri-urban is variously classified, but that would be another layer to explore. In other words, in areas with high population densities, it's spreading in a certain manner, and in rural areas, it's spreading in a different manner, or rather relatively slower, which is expected. But this also has to be tempered with the fact that, at least in some rural districts of Maharashtra and Punjab, mortality rates have been in the 4 to 5% level, which is against the WHO's benchmark of 4%. So, on one hand, while it will seemingly be comfortable that it's less in rural areas, but they would actually require greater attention in public health management terms, because this would be inherently relatively weaker health service systems.
Okay.
The other issue, of course, is the entire spectrum of vulnerabilities that urban slums or urban poor in general, whether it's urban slums within the main city areas or peri-urban areas, or even old towns, older parts of the towns, vulnerabilities in terms of access to water sanitation, vulnerabilities in terms of access to distancing, and so on, and which, as Dr. Murhekar very rightly said, the emphasis will continue to be on containment strategies, and therefore we should build in the whole range of vulnerabilities that we need to negotiate ahead.
Okay. Okay. Let me bring in Dr. Gurtoo as well here, and then perhaps we can look at the other aspects also. But Dr. Gurtoo, as the results are indicating, and as both Dr. Manoj and Dr. Rajib are also pointing out, would you agree that the people-centric and the risk-based, interventions or risk-focused interventions in urban slums seems to have done the trick here in this fight against COVID-19? The same perhaps will have to be, emulated in the rural areas as well now, as the Sero-survey results are showing.
Oh, yes. It is the population-centered risk management which has played a crucial role. And not just population-centered risk management, but also population-centered engagement in terms of the social connect to get the message across of the various social distancing and other preventive measures. So these have made a difference, and these have to be replicated as a model, as Dr. Rajib said, but they have to be fine-tuned depending on the contextual vulnerabilities of that area. Because we are talking not just of person, we are talking of people, populations. One. Two, we are not just only talking about people and persons, we are also talking about places. Each place, it's each unique epidemiology, each unique expression of transmission chain. And we are not just talking about people and place, but we're also talking about time. What time is it in terms of the curve of the epidemic in that place, in that population? At what time, at what position are we? So time, place, and people all considered at a population level. The strategy has to be contextualized, but essentially the model has to be the same based on surveillance, rapid response, that is test, and then follow them up, trace, and then isolate or quarantine depending on the symptoms or no symptoms.
Okay.
In this strategy, yeah, sorry.
Please carry on. Please carry on, Dr. Gurtoo.
What I wanted to emphasize, though I come from a tertiary sector, I represent medicine, where we treat the patients in our hospitals here. But I would say that amongst this entire sequence of our response, tertiary care, the hospital comes last. Because as Dr. Manoj Murhekar just said, that the surveys reveal and reflect that for every one person that was picked up, maybe 20 to 30, anywhere between that, were still out there in the community. So at the hospital, I'm waiting for that one patient, while 20 to 30 are going free in the community, transmitting it further, building up the epidemic. So the focus has to shift away from hospitals and ventilators, as we now know, to the community. And that's where the whole thing, priorities should lie henceforth.
Okay. Dr. Manoj, would you agree to that point coming in from Dr. Gurtoo there, that the focus should be now on those number of infections which obviously have come down very considerably from, if you do a comparison from the ones which the Sero-survey, first Sero-survey results show?
Absolutely. I mean, I fully agree with Dr. Anil's point. The findings of the Sero-survey, as well as the picture of a COVID in the country, indicates that a large proportion of population is still susceptible, and the time-tested strategies which have been implemented in the country since the pandemic has started, like testing, like tracking, like isolation, like quarantine, should continue. And more importantly, the non-pharmaceutical interventions such as social distancing, such as use of masks, as well as hand washing, need to continue both in urban areas as well as rural areas, because what we are getting higher prevalence in urban areas or urban slum now, and since the epidemic has already reached rural areas, and we are going to see more cases from rural areas in coming days. Therefore, these interventions must also be implemented in same rigor in rural areas as well. So I agree with Dr. Gurtoo's point.
Okay. One more aspect here, based on this particular Sero-survey's report, Dr. Manoj, what do we understand as far as the entire concept of herd immunity is concerned? Because these figures clearly show that that particular concept doesn't seem to be kicking in as far as our country is concerned so soon.
Yeah, I mean, this was a very broad picture what we got at a national level. But if you see the findings of Sero-surveys conducted at certain urban areas such as Mumbai, Pune, Chennai, Ahmedabad, wherein we get very high prevalence. Like in Mumbai, the prevalence in a slum area was about 50+%. Similarly, in Pune, we also had a very high prevalence. In Chennai, we had about 20-25% of the population was exposed to the SARS-CoV-2. So when we see at the broader picture at the country level, we still have to go far. Whereas in these urban areas and in urban slums, a large proportion of population is exposed. But yes, I mean, if you see at a country's level, it is still far way to go for that herd immunity threshold of maybe 60-65% to reach.
Okay. Yeah. Okay. And broadly, if you look at, the upcoming festivals, because the Sero-survey results clearly should, help us in forming our strategies. Now, with the fact that, people-centric and risk-focused interventions will have to be made, and specifically in rural areas, as the Sero-survey results show, what, according to you, should be the strategy as far as the festive season is concerned? Because obviously the people are now moving about. It's going to be Unlock 5.0. How should the respective administrations, both at city level, state level, as well as the central level, go about it?
Yes, my colleagues mentioned, I think there should be a strong focus on changing in behavior, basically. The things which have been followed, like following of non-pharmaceutical interventions, need to be very strictly adhered to. Use of masks, use of following physical distancing needs to be adapted at every level. And the testing, tracking, and isolation should also continue. So these are the two important messages that we need to give to the community in order to prevent the transmission further.
Okay. Dr. Rajib, your views on that aspect, really important, because it's soon going to be the festive season.
Well, taking forward what Dr. Murhekar said, the focus, and as Dr. Gurtoo also sensitized us to the fact that it's hospitals which would actually cater to 1 in 15 or 20. The boots on the ground, which is the field level activities, currently are overwhelmingly focused on testing and isolating and so on. But in the very long journey ahead, we don't even know how long it is. It's really the preventive practices, as we keep emphasizing respiratory etiquette, physical distancing, hand washing, etc., which are really going to be key. The point is that what really are the ground level activities vis-a-vis these? Dr. Gurtoo spoke of much closer engagement, of much closer community engagement, much more effective risk communication with communities at extremely local levels. So, for example, do we actually have engagement strategies with very marginalized segments, such as custodial populations, say in jails, where in fact infections have been high all over the world? Are, for example, communication messages tailored to, let's say, the linguistic minorities? Are, for example, facilities or amenities or messages tailored for those disabled, which is a very high number? Also, the fact that not just that these are vulnerabilities, but these are also the people or communities who are more likely to suffer from loss of employment or loss of incomes and so on and so forth.
Okay.
So this complex of challenges and engaging with them at the community level is really what's going to make or break things from here on. Now that the initial wave has been managed, and we must agree reasonably well.
Okay. Before I move to Dr. Gurtoo on this part, one more thing, Dr. Rajib, and that is, about what does this Sero-survey tell us as far as the concept of herd immunity is concerned, something which, Dr. Manoj also pointed out.
Well, I'm fully in agreement with what Dr. Murhekar said, and what he's essentially alerting us to is that there is a huge unfinished agenda, if I may, and an enormous task that central, state, and local governments and local health authorities will have to negotiate with. And as Dr. Bhargav, the Director General, very rightly said, he pointed to a possibility of fatigue across the 5 T's, as he spelled it out. And fatigue really is the biggest worry. Now that we have had this journey for 6 months, and as we all know, we don't know how long this journey is. So the focus really has to be on fatigue and how best we are able to negotiate with this fatigue, not just at the community level, but at the provider level, at the frontline staff of all departments, not just health. There is the police apparatus, other government servants, even volunteer forces, NGOs, and so on.
Okay. Let's now bring in Dr. Gurtoo, and Dr. Gurtoo will look at 2-3 aspects. But let's begin with the last point which has been made by Dr. Rajib, as well as tackling the pandemic fatigue as such. The way we are looking at the situation, we've been in it for almost 6 to 8 months now. And, the Sero-survey results, what they say about the overall concept of herd immunity, as Dr. Manoj was pointing out, in certain specific geographical locations, yes, this might be hinting towards going up to a particular herd immunity level. But overall, from the national perspective, we're too far away from that, so we can't let our guard down.
Yes. So Dr. Manoj and Dr. Rajib are public health experts. So I'm looking as an outsider looking towards public health. I'm a tertiary care physician, and my role is treating patients who already are in my hospital. Now, as a tertiary care provider, I have 2 questions that arise within me when I hear about the Sero results from Dr. Manoj. One, I ask, what's going on? What's going on at the national level? And 2, are we protected? Are we safe? What's the meaning of this survey? The answer has already been given by the 2 public health specialists, Dr. Manoj and Dr. Rajib. What's going on? Yes, as he said, that 6.6% overall of us Indians have been affected and recovered. IgG recovery has also occurred. So we are looking really towards the past. We are not in the present. Present is what's happening now, the RT-PCR. So now we are looking from the present towards the past, and 6.6% roughly pans out to 88 million or so, I suppose, million people who have recovered and are now seropositive. Now, that raises the second question: does that mean I'm protected? Especially Delhi, 33%, Pune, 51%, Mumbai, 40-something percent. So are these, at least residents living in these clusters, these density, these urban locations which have 40, 50%, 30% plus protected? The answer lies in, again, the same thing what Dr. Rajib began. How much does it amount to in terms of the spectrum, or what he used the word spectrum of susceptibility?
Okay.
So even in Delhi, if 33%, even Pune, if 50% are protected, so we don't know for sure, but let's assume they are, then that still means in Delhi more than 70% or so are still vulnerable. And that's not when the herd immunity really works. And the other thing is, this herd immunity is not a good model to rely on, because these are all watertight compartments between those who are susceptible, remain susceptible, and they recover, they get infected and then they recover. Now, the susceptibility or the vulnerability, as was said, is a very dynamic and shifting process. People are moving in and out all the time from urban spaces. Newer people bringing in newer susceptibilities and vulnerabilities. So it's not a static thing that we have attained this much and now we are protected.
Okay.
So as a clinician, my biggest fear is that this might send out a psychosocial message: all's well. And festivals are approaching, so let's go and enjoy it without anything else to worry about. That kind of a messaging, psychosocial, that all's well, may create problems for us at hospitals in terms of more caseloads coming in after the festival spell ends. So from that perspective, we have to go back to that what was repeated: surveillance, quick response, test, trace, and then isolate, and continuous community engagement, risk communication, and backed up by, of course, the hospitals in their full readiness.
Okay. Okay, so there it is. Thank you so much, Dr. Gurtoo, as well as Dr. Rajib and Dr. Manoj, for sharing your views on those results of the second Sero survey and what needs to be done based on what we know about the Sero survey results, what they tell us. There are two aspects. One is that 6.6% of our population has been affected and recovered. That clearly means that large section of population is still susceptible to COVID-19. And this gives us the focus on ensuring that we do not let our guard down. We do engage in all protective steps which need to be taken: wearing masks, ensuring respiratory etiquette, and also maintaining social distancing. The festive season is coming around. Please ensure that you follow all these normal norms and protect yourself as well as your loved ones. We'll come back again tomorrow with a different topic. Till then, keep watching Rajya Sabha Television.